So in this video, we're going to be talking all about a non-STEMI versus a STEMI rhythm. And I'm going to help you to better understand what it means, what is the implications of it, how should you respond when you see it, especially when it comes to your nursing exams, or for those of you that are monitor technicians, or as a hospitalist, a doctor. What do you need to know? So definitely stay tuned and watch this video to the very end as we go into it right now. All right, so let's go over this rhythm. Hopefully you're going to better understand the difference between the two. And I'm so excited to go over this training with you. The first and number one is, let's first talk about a rhythm in the first place, right? Let's talk about what a normal rhythm even looks like. And what I have in front of me today is actually brought our book, our EKG book, so that we can see what it looks like. We're gonna move on in. So you see here, this is a normal rhythm here, okay? So we have a P wave, we have a PQRS, right? And then we have the T wave. Right, so I'm doing this backwards. So the P wave, that represents the atrial contracting, the QRS that represents the ventricles contracting, and the T wave that represents the ventricles relaxing. All right. So now what happens though is when you are looking at a rhythm, it pretty much represents the movement of an impulse that's traveling through the heart. Okay, that's essentially what you're looking at. And that's the way you kind of have to see it. It's the movement of an impulse traveling through the heart. And so it's going to reflect the anatomy of the heart. It's going to reflect what's going on with the heart muscle. So when somebody is having a heart attack, what happens is that there is an occlusion. All right, there is a total occlusion of blood flow. So you see all these red blood cells coming through and everything normally, healthily. So when somebody has a heart attack, too many of them, they begin to essentially clump together like this. And so this is usually why we'll do something called MONA, which is now called ONAM, which is where we give them oxygen because there's a huge oxygen deprivation. And then we'll give them nitroglycerin. The nitro helps the vessel to relax. And then we give them aspirin. Have you ever wondered why we give the aspirin? The aspirin, it helps all those platelet chunks you just saw right now, it helps them to separate. So aspirin is what you call a platelet deaggregator, DE aggregator, all right? I'm not gonna spell the whole thing. And so essentially what it does, it helps to separate all those platelets all collecting together, which is causing the patient to have total absence of blood flow. That's why they're having the chest pain. That's why they're clutching their chest. And usually it's going to be a dull, achy pain. And most patients, they're going to have other symptoms, which includes shortness of breath, diaphoresis, nausea, and their skin color is going to look pretty pale. Like they're going to look like they're having a heart attack. But sometimes you wouldn't even know they're having a heart attack, to be honest. So this is some of the things you have to be concerned about when we have patients that are having a true heart attack. So let's go back to talking about the STEMI, right? So while showing here on the rhythm, right? So what happens here, this section, the S, all right, this S, this section right here, when they have a STEMI, it's up, it's higher, it's elevated, right? So you see how here, which is a normal rhythm, it's flat, right? So when it's a STEMI, it's elevated. Non-STEMI, it's non-elevated. STEMI means that it's elevated, right? And so that usually is indicative of a true heart attack. If they're having a true heart attack, that's when we're going to do all the work I just told you right now with the ONAM. We're going to give them oxygen, we're going to give them nitro, we're going to give them aspirin, and then maybe we'll give them morphine if they're still having pain. And usually morphine will be for women most of the time. So most of the time, normally men and women are relieved with the nitro. But if it's not relieved, then we can give them morphine. And I typically see it's more with women that need the morphine than men. And you do have to be aware if you're going to give them, when we're giving them nitro, most patients, they're good after the first dose, right? So usually it's no more than 3 doses max. And we give them a few, usually about 5 minutes for it to work in between. But usually it's relieved within the first dose. And if it's not, then we'll give no more than 3. The reason why it's important too is because there's some drug that the patients are taking that can cause their blood pressure to drop. So one of the medications that you're going to see when it comes to it causing them to bottom out along with it is called sildenafil, which is also known as Viagra. So if they took in Viagra recently within the past, usually I want to say 24 hours, and you give them the nitro, their blood pressure may drop significantly. We don't want them to bottom out because we would have to give them fluids and they're having a heart attack, right? So this is one of the things I have to be mindful of, is asking. That's why we ask them, have you took any drugs recently? What type of medications are you on? All that type of jazz is super important for us to know. Have you gotten our books to help you to pass your nursing exams, medical exams, your NCLEX test, pharmacology? Right now, you can go to the link below and check out some of our books. We have a wide selection of different books that's going to help you in your journey to becoming a nurse or even a pharmacist or a doctor. We have our How to Select the NCLEX book, which is helping you to pass the NCLEX as a repeat test taker. We have pharmacology flashcards. We also have our pharmacology cheat sheet book, which includes mixing insulin and learning more about how dosage calculations work, as well as just going over pharm in a lot more detail. We have a tease book. We have our 70 diseases and conditions book, and so many other different books. If you want to learn more, simply click the link below to get access to our books today. So this is the things that you need to really understand about the heart attack patients when they're having a heart attack, is also what type of symptoms they're having, the dull and achy symptoms. And then also we want to monitor their O2 sat as well. And then remember that I mentioned earlier, I said non-STEMI versus STEMI, right? So it's possible that they could be complaining of chest pain and they don't have a STEMI. So which means that they don't really have, and what happens in this situation is most of the time their troponin levels will not be abnormal. So there's something called a troponin level. So when they are having a real heart attack, we're going to do a stat EKG, right? The stat EKG is going to reveal this, like I was just showing you. And then we're going to do a troponin level, 3 of them. Usually they're going to be 8 hours apart, but sometimes I've seen it where they do it less time in between. But normally it's usually 8 hours apart. And what happens, so what the troponin level is doing is that if somebody has a true heart attack, right? So troponin is a type of cardiac enzyme. If somebody has a true heart attack, then the heart is going to experience a level of damage, the muscle in the heart. And that muscle in the heart that has that damage, it's going to release troponin, right? It's going to release those troponin enzymes in the bloodstream. So then now when we check their blood levels, the troponin will be elevated, which indicated that they really did have a heart attack, right? So that's why we check it. That's what we're checking for, is to check the troponin levels. So we're checking the troponin levels, and then many times too, they may also be, we'll also do what you call a cardiac ultrasound. A carotid ultrasound. We'll get an ultrasound of the carotid arteries, and what that helps us to see is how much occlusion is going on. If there's a lot of occlusion, that's also an indication that their blood vessels are full of plaque. So this is why we pay attention to them if they have coronary artery disease, or if they have high cholesterol levels, hypercholesteremia, because what happens over time is that plaque builds up, and that causes them to have a heart attack. And then they have to have a stent where they go in and they literally put kind of like a catheter in the vessel, and it breaks it up, and that allows blood flow to go through. So when you hear people say like, oh, they got a stent ×2 or ×3 or whatever, they literally needed a stent to go in and break up the occlusion of all that plaque, so that way they can get adequate blood flow through the blood vessels in the heart. All right, so that's essentially what it is. So when we are looking at a STEMI, ST, right? So ST, that means ST elevation myocardial infarction, right? Non-STEMI, NST. All right, so let me put it here for you. ST, so that part of the rhythm is elevated, versus non-STEMI, it's not elevated. That's essentially what it means. All right, so ST elevation, and so this is usually worse, okay, usually worse and a lot more serious, and the patient could essentially die if we don't do something right away. So time is of the essence in these situations. You have to respond immediately, and you do something for the patient, because it's pretty serious. It's very serious. Of course, the patient's going to need teaching, so we have to educate them, making sure they understand the implications of their diet, changing their diet, exercising. That's usually a really big one. Their blood pressure, managing their blood pressure, all of those things. They all are corresponding and causing them to have a heart attack. These are the things that we're concerned about. If you feel like you're really struggling to pass your NCLEX exam, then I want you to click below to register right now for our upcoming 6-week review, where we're going to teach you how to pass your test, how to think more critically, how to be prepared for the next generation NCLEX exam, and what you need to really know when it comes to taking the exam and passing it once and for all. Click below to register today. All right, so I hope that you found this video informative. Hope that you learned something. You can always visit the link below for more resources. Thank you so much for watching, and we'll see you the next time. Make sure you like, subscribe, comment below. Tell me one thing that you took away from this video, and I'll